legislative staffer who has tested positive for COVID-19. And so they're going to be doing the contact tracing and all that stuff there. As far as the budget session, they're obviously not going to be doing a face-to-face, and there's a bunch of disinfecting that's going to be going on. So I'm assuming, I don't know, what did you get from what Phil had, we had the executive director of the legislature on. What did you get from what he said? Probably not going to be a session today.
Yeah, I think they're going to figure out the whole teleworking and then just the contact tracing and just kind of get all of that sorted before anything else.
Right, and there's a lot of contact tracing going on now. If you just, in your mind, kind of list down all the different places that have had exposures, and it's a lot, and they just keep coming. So we know that, public health is saying that they have the contact tracers, but let's find out. We'll go to public health now, and these guys are working so hard, so really just want to get them on and make the most of the time that we have with the medical director, Dr. Jana Maglotnia, and we also have this morning the territorial epidemiologist, Dr. Ann Pogbutsky. Good morning, ladies.
Morning. Morning.
Good morning.
Thanks for joining us.
Thanks for having us.
Always a pleasure to have you, Doc. So, people are saying this is the second wave, so let's just start there. What are your thoughts on those comments that we're hearing? I'm hearing it from doctors.
Mm-hmm.
Well, it's not really a wave. I think what it is more like a smoldering fire that flares up. We've actually had a big peak in March. It kind of went down during the lockdown. We had a smaller peak in May. It went down, and now we are seeing another a surge, if you will. But I don't know if it's really a surge or if it's part of the whole same phenomenon of infections that flare up and then simmer down.
Right. And yesterday I was looking at the numbers, like for example, during PCOR 1, within 58 days we were in PCOR 1, we had 151 positives. PCOR 2, the 71 days, 164 positives, and within the past 24 days in PCOR 3 we have 134 positives. And I know that doesn't factor in the testing capabilities, but at the same time, these numbers, they really are, concerning. And I guess you're right when you say that it is this fire that's flaring up again.
About the numbers and about PCOR 1, PCOR 2, PCOR 3, I've heard people try to bring up the percentages. We thought above 2%, blah, blah, blah. I think the best thing I can say about all of that is ask me today what the rules are today, because as it changes, we change. A rule we opened the day with yesterday morning is probably going to change today because of flights or because of case number or because of contacts or gatherings. It is a rolling stone, and you can't hold one thing I said last week against me today, because I'll go, yep, changed. It's the way it's the nature of COVID.
Mm-hmm. And I remember,
and someone asked me if we saw lasting sequelae from some of the COVID patients. I said, what's that? It's only been around for a few months, so who knows?
And I remember at the onset of all of this, one of the messages from public health was act like everybody has COVID. And I feel like we need to continue with that message right now.
Right.
Like just
actually more so now. I think when we locked down and we all saw the 0, the 1, the 0, the 1, we were yawning and thought, okay, we got this. And then as we opened the lid a little bit and people relaxed a little bit and had large gatherings, let their guard down, that cases coming in, it seeped in. It's almost like you punch a hole all over a pool cover and the water's coming up through all the holes. So if you say, what is it? Contacts? Yes. Is it flights? Yes. Is it local community spread? Yes. It's every hole in the pool coming through now, and it all adds together. So I know that's the best analogy I can think of, because it's not just one place. So you shut down the airport. What do we do about the community? You shut down the community. What do we do about the airport? It's like this.
But at what point, we're in peak or 3 and the doors, wide open. When do we say, okay, we got to shut the door again?
Yeah.
Well, I don't know what the governor plans to do, but the door being open at the airport, it hasn't really been the problem now. We have had some come in, but most of those are going straight to the quarantine facility. Anything going to the QFAC is contained.
Right.
So I don't care if there's 1,000. They're locked down.
Right.
So that part I'm not as worried about, because you have to. Okay, right now, if you come in with a negative test from almost anywhere on Earth except the Ukraine, you're allowed to. If you come in with a negative test, you could go home quarantine. If you don't come in with a negative test, you go straight to the facility. It may be that we may need to massage that home quarantine until they've had 2 tests. And so there are little things we can do like that, although we haven't had a big surge from that.
Right.
But that's one little hole we can lock down. The one that we can't control, and this is a biggie, the community, what they're doing out there. We can line up all of our ducks, but they can shoot them by just having gatherings, not wearing these. We haven't seen a lot of transmission at all from people who observe the protocol. I've sat next to how many people with COVID, but with the mask and social distancing, I haven't contracted it yet. As of yesterday, my most recent test.
Right.
But we have seen plenty of transmission from people who didn't wear these and didn't follow the protocol.
Right.
And that's the front line. That's the loose cannon. What can we do? And it creates a situation for the whole community. So, we understand people want to have gatherings, and if it only impacted the people having the gatherings, we're not happy with that, but we have to live with it. But the fact is that those people contact people who contact people. If it stayed contained to the people who wanted to do that, it would be different, but it doesn't. It's a communicable disease. And I know the contact tracers can tell you how many people on average are exposed.
Right.
And I've heard numbers tossed out like 15 here. They look at how many people they have to reach out to on a positive case. And the number a couple months ago was like 15. I know last week there was one that had 40 contacts. And I mean, direct hands-on contact, not just in the room.
Popular person.
Sorry?
Popular person. Go ahead, Doc.
Yeah, I mean, well, I don't know if you're popular or not, but, Sorry. So, what can we say? There are things we don't have control over.
Right.
And the ones that we do, we're massaging to do all we can. But the last bit of that equation is the front line, and the community's the front line. So we have to really, really make sure people are doing this, because this is our first step and our best step.
Right. So, Doc, when you talk to these positive cases and you find out they come into contact with 40 people that they've been, having is it the gatherings and the bars? That's what we're being told. Are those the 2 main ways that people are spreading it? And then also I wanted to ask about the when you come in with a negative test, right? You could be negative at that moment, but if you were exposed and you're positive, so that's why we kind of want to tweak that and maybe test people again after they come in, even if they do have a negative test.
Or even if you don't repeat the test, just go ahead and have them follow the guidelines and just remove themselves from active contact with people, or be extra vigilant about using the protocols that we have in place.
Yeah.
As far as surges, pick a place. Have we had cases from a bar? Yes. Have we had cases from, funerals? Yes. Have we had, it's like I said, it's like the pool cover. It's percolating through several holes, and the bulk of them can be community related. So if we could now, I mean, if people would in the community would just use the protocol and socially distance and wear the mask, we may see a big reduction in those.
Right.
What about community testing? We had Dr. Ho in earlier this week, and he said that the idea is to move towards more target testing as opposed to community testing. And they were going to be meeting with public health about this.
Yes, that is part of our testing plan, is much more targeted testing at specific places. For example, they're doing the DOC today. So the mass testing was fine. It was trying to, placate the community, give them something to, have testing available to anybody. But now we're focused more on targeted testing, more on contact tracing, testing of contacts and previous contacts, and that sort of thing. So yes, that is part of our testing plan.
Is that, he said it was like a strike force? Is that correct?
Well, I think that's a dream. That's a dream that we would have a SWAT team go out there with a mobile van, and I don't think that's possible.
And we pin you to the ground and swab your notes.
I don't think that's possible.
Aye, day.
But definitely this move
Also,
towards target testing.
we can't do, some people think we can do investigation if we go out with a mobile unit and just pull in the parking lot, line them up, herd them in. But contact investigation really takes time. And luckily, we have had the occasional person with many contacts. The bulk of the people are down around the 15, about the 15 number is a good average number. And so thankfully that's the case. But even contacting 15 people takes time. Yeah. And that won't occur when we swoop in with our van and pin you to the ground, while we're swabbing you, going and name them. So, yeah.
Can you talk about the testing protocols, right? So we're seeing with this latest rash of positives from the governor to the lieutenant governor, they take a test and then they say it's negative, and then they get to take another one and it's negative, and then they take another one and it's positive. So what's the protocol with the availability of testing for these? Is it the same for the high-ranking government officials as it is for the little guy, or do we ramp up the testing when someone is part of a contact investigation? Can you just kind of explain the process for that?
Well, all contacts of positive cases are offered testing now. That wasn't true at the beginning of the outbreak or pandemic, but it is true now, yes.
And do we retest? We retest a lot of people. It's a case-to-case basis. We've tested people as many as 7 times because it really looks like COVID. But you've got to catch it in the perfect little area of the curve. And so that's why on the sit rep, you'll see clinical cases. How did we come up with that? People who continually test negative, and we know they have it. But there is no 100% right now with these emergency use authorized tests. Right. And so we try to keep testing when we just know it's positive. And sometimes we don't capture it, but we treat them as clinical cases. So yes, we do a lot of repeat testing.
We had
and we have a lot of people who finish their protocol and then go out to their own providers and ask for more tests, just to be on the safe side. So those we don't have numbers for, but do we do repeat testing? Yes. Across the board, no need to. But if people still want to go to their provider and get another test, they totally can do that.
So do you ladies think that mass testing of the community, because we're just getting inundated and overwhelmed with just people who want to get tested and they can't afford to go to the clinic, or for whatever reason, in public health, obviously you got to do the appointment thing. So are you saying that mass community testing isn't needed right now? It wouldn't help at all? I'm just curious, no, Dr. Ann, because you had said that you did it before to kind of placate the public. And I think now, they would probably need to be placated a little more now than back then.
Yes, and we understand that people are scared when they find out somebody at a place of their work or a school or whatever tested positive. They think, oh, I need to get a test. But again, where is the contact? Where's the exposure? It has to be a close, prolonged contact. Just because somebody at a workplace tested positive doesn't necessarily mean that 500 people have to all get tested. What the contact tracers and case investigators do is look at the person's workspace or whatever and their close contacts. Same thing with a plane. If somebody's positive on the plane, we don't have to test everybody on the plane. We look at where they were sitting, were people wearing masks, 3 rows up, 3 rows back. So we have to be systematic and focusing on close contacts where people might have actually had exposure, as opposed to maybe you had a fleeting encounter with somebody in the hallway, you were both wearing a mask, that person tested positive later. That's not a close contact. So
That's every day for us.
that's right. So
But you know, and I'm sorry, the real part. But you know, I was trying to think of an example because analogies make more sense. But when you have, and I haven't been in service, but I know in combat they have point guys that are out in the front. I don't know their MOS, but they're out in the front looking to see what's out there. I would liken our mass screening to that. What's out there? All of a sudden, you hear a lot of noise at 20 degrees to your right, and everyone goes there because that's our answer. We've got something cooking over there. So the forces and the effort go to that targeted area. Then there's another targeted area, and you go there. So the purpose of seeing what's out there with mass screening morphs a little bit when you see that you get your answer. Over here, over here, over here, over here. So we mobilize the team and go after that. We seek and destroy and seek and confine. We try to constrain it or contain it in those areas. So the plan and plot changes as it changes.
Right. But Doc, I mean, if the call was made from the governor at the top and they said, no, we're going to do a community mass testing, would public health be able to, you know, logistically and with the personnel be able to hold one?
Yeah. Oh,
Okay.
yeah.
Yes.
We can do that. I mean, when you're just throwing out grass seed to see what grows, you know, you've got all the team members there. When things are popping up, you shift some to that and keep some here. So you shift what, from 500 to 400 here and from 0 to 400. Yeah, that's what we do.
Speaking of community testing, has there been any? Are there any plans to reschedule the planned community
Yes.
testing for? I think it was Ematic and
Right.
and Telefofo.
Yeah.
Yes, the ones that were postponed due to inclement weather. There are plans. No dates available. Yes,
Right.
yet, but yes,
Okay.
they will be rescheduled.
yes, but it's not going to be as frequent because we are focused more on targeted testing. So if there is an outbreak somewhere, we're going to focus more on that and less so on just anybody who wants to get tested can go somewhere. It's going to be more limited from what I understand, the
Right.
mass testing.
Can you?
It didn't yield a lot of positive cases, the mass testing, because we were testing anybody who wanted to be tested without regard to any exposure or symptoms. And it didn't yield a lot of positives.
But are you
So
guys?
we're focusing more on the targeted testing, the contacts, outbreaks, and so on.
So,
And you know, when you're doing the mass screenings, you're out there, like I said, just throwing out grass seed to see what takes. And people drive up, are you having symptoms? No, and they check them. When you, in fact, have a case with contacts out here on the right wing, that's where your energy should be spent because we got a hot potato over here. Let's see where we're going with that. And when you get several of those, it may not be big numbers, but any of it's probably larger than what we collected through the mass screening.
right. So is there anywhere, if people are listening and they don't have the money, is there any way they can get tested with public health if they're not falling in that, came into contact with somebody who tested positive? Is it still by appointment
if they
only,
have
or?
a provider, they can go to their provider, but unless somebody was a close contact or they have symptoms, right now, all we have is the test for the presence of the virus. It's called a molecular test. We're also planning to do serology testing in the community to see if people have antibodies to the virus, which is different. The PCR test that we do for the presence of the virus, that's what they do at the mass screening. That's what they do at your doctor's office. If people haven't had close contact with a positive case or they haven't been exposed, there's probably no need to get tested, and especially if they don't have any symptoms.
When you say close contact, are we talking about over a prolonged period of time, or is it just like I had a meeting with someone? Would that be considered
How
close?
long was the meeting?
Right.
Yeah.
Because I'm just hearing that certain people have had meetings with
Right.
certain individuals,
Yeah.
and other people got to be moved to the front of the line and got tested, as opposed to another individual that tried calling a private clinic, and they're like, "Oh, well, you don't have any symptoms right now, and we can't even get you in because we're booked full." But yet, this other person
Yeah,
was
that's
tested immediately
Yeah.
and negative.
And so what we're talking about here is that we have what appears to be, one set of protocols for the higher ups, and then the rank and file that are talking to us have sat in these same meetings with the high ups. The high ups have gotten tested, and they're still waiting to get tested. So if they were in the same, that's why I'm kind of asking what the protocol is, because we're hearing from people who sat in on meetings with,
COVID
known
positive.
positive patients that, very well known positive patients, and they haven't been tested and they haven't been given the time of day.
If you're, I can't really. If we were offline, I could hear more the
Yeah.
Right,
details that
right.
we could investigate.
Right.
But in general, when should you test anyway? Within a few days, maybe 4 or 5 days, because if you're exposed today, the likelihood of it being positive within 24 hours is not very high. But in general, we use close contact, 6 feet, 15 minutes.
Okay.
But you know what? I've been through how many of those with a mask and
Right.
6 feet, and I've been checked once through Naval Hospital and once here, and I've been very fortunate,
Right.
because I don't want to take this home. Nobody does, but some of our frontliners, unfortunately, have.
Right.
And where are we? Because, I know there was this effort early on to test, like the police officers, the firefighters, and it was going to be done through the National Guard. And then I can't remember what we were told, that they decided they weren't going to do it, or they couldn't do it. How often are the frontliners tested, or they don't need to be tested unless they're exhibiting symptoms?
No, we do what we call serial testing. That's part of our targeted testing plan, is to test first responders and healthcare workers as needed, and they can get repeated tests because they're exposed all the time. So that is part of our testing plan. We test healthcare workers as needed from the hospitals, from the clinics.
Are you able
But
to?
not regularly.
Right.
If we couldn't test every time we're exposed, because we're sitting in the lab now where every sample is brought in.
Right.
We plumbers have the worst plumbing. So, I mean, if you get my drift.
I do. Yeah.
I tell you what, if we, none of us want it, but my gosh, if we went home worried every night about
Right.
what we came in contact with, I don't think we'd sleep.
Right.
And we understand the anxiety, but anxiety is sort of like us every day, just we think, was that a hit? And when you hear a frontliner contracted COVID, or you're calling going, how bad is it? You almost feel like we were sitting there yesterday going, I just would love to have a mild case, get it over with, form some antibodies and march on, and without this, you keep waiting for the other shoe to
Right.
drop.
And I think that's where the anxiety comes in, Doc, is that a
It
lot of
does.
people have made it this far. They made it through what they thought was the worst of it. And they're standing here today and, feeling like, oh my God. And then, just mentally, and then boom, right? And so people are anxious. They don't know if they were exposed, and they're and I think
Right.
another thing that leads the anxiety is they question whether or not you guys have the staff to go out and investigate. How many different contact trace investigations are currently ongoing? Because we just keep hearing about places and that, the contact tracing is being done. So do we have enough staff? And I think that's where, in a lot of people's mind, it's like public health is overwhelmed investigating all this stuff. They might be missing some things. So can we go get tested? And I think that's where people's mindset is. And trust us, because they're calling and that's what they're saying. So how many different
Right.
investigations do we have ongoing right now?
Oh, Plenty.
Yeah, there's a lot. There's a lot of ongoing investigation. And, you brought up the issue of the higher ups get tested and then the lower down don't. That's not true. If you have actual exposure or you're a contact, you can be tested. We can arrange for that. The problem is that people are scared and they want to get tested and they haven't had any exposure, or they think they've had an exposure, or they're scared. That's not a reason to get tested. Okay, you really have to have had close contact with a positive case. And one of the reasons these so-called higher ups were tested is because they were in contact with a positive case.
Man,
So
Dr.
we also
Ann,
have physicians who have tested positive. So, we don't already testing for higher ups.
Right,
and
right, right.
Nobody,
Yeah.
There's no cherry picking.
there's no cherry picking.
I
here.
But
respect-
what you don't hear is the backstory.
Right.
If someone got tested, there was a reason.
Right. Right.
Unless they just drove up and said, hey, test me, which didn't happen with the group you're speaking of.
And again, we do see more results from the testing when we're doing targeted testing.
Absolutely.
Compared to the mass testing. We tested over 5,000 people over a 3-month period and only got 42 positive cases out of all that mass testing. Almost 5,000 cases. That's very low. That's less than 0.01%.
And asymptomatic, most of them.
And most of them were asymptomatic, and most of the people who were positive were people we sent to the mass testing because they were contacts, household or community contacts of a positive case. So 2/3 of those 42 cases were actually people we sent to the mass testing to get tested. So the mass testing is not a really good way to test the population.
It's okay to just to see what's out there.
Right.
But when you're wanting to see what's out there, and then all of a sudden you get, I'm going to call them clusters, but they're not necessarily.
Really. Yeah.
But when you're busy saying, hey, I want to see what's out there, and you got your binoculars, and all of a sudden you have flares here. There's your answer. Go there.
Right.
That yields more than that.
Can we talk about the Hawaii flight and the 92 passengers that were quarantined, and the fact that one of them, I guess he found out, or she found out on the plane that they were positive? How does that?
Investigation's ongoing. That one's a brand new one, so
Right.
we don't have any data on that
Right,
yet.
but how does someone find out on the plane? Why didn't the results come back before they got on the plane?
We've had several of these actually.
Right.
They
Doc,
are
I'm
tested
sorry, Doc.
before the.
Doc, can you move over a little bit because you're sliding out of the shot, and we want everyone to see.
Oh, let me slide more. out
We
of the
want to
shot.
see you.
Yeah. Okay. Go,
There you
go
go.
ahead. Sorry, Doc. Sorry. Go ahead.
Some people get tested
Numbers
before
just
they
went up.
come here, but they don't get their results yet.
Yeah, some are
I
tested. Imagine you get tested in Texas, and they try to contact you while you're when you're gone. They don't know if you took a flight or whatever, and then the notification comes while you're in the air.
Right.
Yeah, I just figured
people
that,
get
you know,
tested, and
wouldn't you have your
they're
results
emailed
before you
their-
got on the plane?
Yeah.
Yeah, and some of them are texted while they're on the plane, and I guess they have Wi-Fi access, and they send them the report while they're sitting in the seat, because what they do is they say test, and by the time you land in Guam, you'll have your test. And, hey, fingers crossed it's negative.
Right.
Sometimes it's not. So that's something that we might want to change, because I think in Alaska you can enter with a negative test. That's not something that that really limits you, to have to board with a negative test within a certain number of days. But I think we may be moving toward that, so this doesn't happen again. So that might be a change. And I haven't spoken with anyone yet because it's brand new.
Right.
But that is something we could change, is say you can only enter with a negative test. And when people start complaining, remind them of this. When they call in and go, why do I have to have a negative test? I can't get one. Well, because of things like this. That's exactly why.
So
So we follow the lead of COVID. If COVID does this to us, well, we can see that we can tweak that and cut that off.
we're still in peak.
Because sorry, go ahead.
No, go ahead. You go ahead.
If we require, and I'm not saying we're going to do it, we haven't done it yet, but things like this, I look and my first thought is, don't let them board without a negative test. You can't get on the plane,
Right.
because 100% of the people on the plane will have a negative test. It does not mean they don't have the virus, as we know about the test itself,
Right.
but it will 100% will board with a negative test, period.
Mm-hmm.
And then when we imagine if you could, and this sounds bad, but what if you demand a negative test to get a ticket? So you board with a negative, and then what if we put you into the quarantine facility and say we want another one in 5 or 7 days after you're there, and then you can go out. Extra layers of protection, very restrictive, but great protection for the island.
Mm-hmm.
But you talk about complaints. Can you imagine?
Yeah.
Better be safe than sorry.
But it would work. Quarantine and these are our front line,
Right.
Mm-hmm.
and they are so effective.
Right. What
In
can you?
your
And I hate to keep preaching that, but that's the way it is.
Yeah, we believe in that. Can you tell us anything about was there a movement of quarantine last night? People from in quarantine to an isolation facility. Are you able to tell us anything about that?
I don't.
Don't know.
We don't know the details on that.
But
That's
I can tell you this: 100% of the people, if they were in quarantine, tested positive, they were moved to the ISOFAC. Now, what that number is, if any, I don't know. But 100% of them get moved.
Right.
What about the procurement of another isolation facility, government isolation facility?
Yeah, because we had Lillian on yesterday, and she said that they were pretty much at capacity
Mm-hmm.
with I think 40.
Over 40.
Yeah, over 40.
Oh, so what they do is look at their expansion capabilities, and those are there. We have backup ventilators. We've got plans for that. That was part of the pandemic planning. Is once we get to this point, then we move to our next level of care.
Mm-hmm.
Doc, I wanted to ask. We had Lillian on yesterday, and asked her about the reopening of schools, and she had some very strong comments that are, seeming very strong. I mean, more strong this morning with everything that's going on. She had said that the reopening of schools was grounds for transmission of COVID. And, she, again, really came out and said that she doesn't think we should open the schools right now. I'm curious
Okay.
what you guys think about that from
I'll
a
tell you
public
what,
health
and I'll let
perspective.
Ann speak too. I talk too much, but honestly, you're not going to give me a conservative opinion that I'm going to bash. I'm like, it's okay. It's okay. If she feels that way, thumbs up. I think we all feel that way at points in time. No, if you tell me that she's feeling conservative about that, I'm okay with that.
right.
Yeah, that's
But what are you
And it
feeling?
might be that we turn into a new normal for schools. They're talking about universities doing a hybrid kind of plan with some classes mostly online and some in-house with social distancing. So the same thing with schools. We've got to come up with a new normal and help our kids. Does that mean giving every little kid a tablet? Maybe it does. And keeping the schools closed until
A tablet meaning electronic device.
electronic. No, a tablet.
Yeah, not our Moses tablet. Right? Yeah.
Here's the other thing. People think, when the restrictions were lifted and people kind of went back and thought that things were normal, this is just the beginning. This is the first 6 months of a pandemic that's probably going to last 2 years. People don't realize that. There's no magic vaccine coming from Russia or China in the next 2 months. This is a new normal.
I'm not sure you were supposed to say that.
I think his stuff is
Keep
getting to
on,
you guys.
keep
Yeah, it's getting to you guys.
Yeah.
No, she's so wrong. She's usually not, but I hope she is. Dang.
Are you guys drinking hydroxychloroquine over there? Or?
A little different.
Well, thanks, Docs. Is there any, I guess, parting words?
Yeah, let's serious parting words.
Actually, that's a good question. Because sometimes we have things that you don't touch on, but you hit about everything and then some. But wow, hang on, ride's going to be bumpy for a while.
Yeah.
I'm getting so many calls from parents. They're anxious, and I understand anxious. Okay, so where's the good news in all this? The good news in all of this, and if you look at the statistics, Guam is doing well. We've had 5 deaths, and look at the numbers. Teddy Roosevelt had 1,000. I don't know how many they had, but we contained that in conjunction and collaboration with the military, and we've had 5 cases. And if you add 5 deaths, and if you add all the cases we've had, and how many were without symptoms at all, known positives, known contacts, but still no symptoms. I mean, we have a frontliner right now and a family member, no symptoms, dead on contact, no symptoms on mild case, a few mild symptoms. So overall, the COVID ride has been bumpy, but the course of the disease hasn't, oh gosh, knock on wood, it hasn't been what has been realized in other places. So we're so thankful, because we did not turn into Italy and New York, and it certainly could have happened here where we're on a rock in the Pacific. I do want to add something too. You didn't ask, but I thought this was interesting. Oh, that's another thing. We were talking to, she's a territorial epidemiologist. I had a doctor write me yesterday in my position as state epi, and I said, I'm not the state epi, but thank you. I'll have to go to school for that. But I was talking to their team yesterday. We have a lot of interesting data, and they were talking about maybe pushing out an abbreviated report and then a weekly, and I have
We're thinking of actually having the daily report on the dashboard, having a more detailed report, because people are interested in some of the data, like doing a graph of the household, community, and travel context. So we're working on getting some more interesting and meaningful data out to the public, and we'll still have a daily report on the dashboard.
Awesome.
And my final comment is people need to keep wearing the mask, social distancing, and also don't have any big parties, and don't go to any big parties.
Right. And with all that, the delivery rate in the hospital is probably going to go down a little bit. Just saying.
Sorry,
Dry
Dr.
run,
Shea.
guys. Dry run, guys. Practice run, guys.
Well, thank you so much for your time.
You got to go, because
No, go ahead.
Give you an interesting statistic.
Go ahead, Doc. Go ahead.
We're going to go on a break. Y'all take over.
No, yeah. What do you got, Doc?
You want me to go ahead?
Yeah, please.
Since March, this was an add-on. Since March, there have been 38 cases in children aged 17 or less on Guam. Daycare had 4, 0 to 2 years. Preschool, 3 to 4 years of age, had 3 cases. Elementary, 5 to 10, 8 cases. Middle school, 11 to 13 age, 9. High school, 14 to 17, there were 14 cases. Among those 38, 42% had no symptoms. So, yes, they're positive, and everyone's scared, and the parents are anxious, but almost half no symptoms. So just thought I'd throw that out there.
It's out there. Act as if everybody's got it.
Yes, you have to.
Yes.
Assume that everyone you're seated next to has it, because they might. We've learned.
Thank you, guys.
I'm still having a cupcake, though.
Go ahead. Our COVID unit is making cupcakes and selling them. So is that where you're going?
Ladies, it's been great. We got some comments in
And
here
there you
about
Here's
your
your
your sense of humor, and people are appreciating it at this time. And hey, if anybody knows about humor as a coping mechanism, you're talking to them. So appreciate it. Let's keep in touch, please.
It used to be
Thanks.
normal. This came about the COVID.
We all used to be.
Okay.
Thanks,
we'll see
Dr.
you.
Ann. Thanks, Dr. Jana.
Wash your
I
hands.
know, thank
Okay.
you.
There you go. Really just appreciate that
Yes.
time with public health, social services. Buckle up.
It's going to be a rough ride.
Yeah, it is. Okay.
Wear your damn mask.
Yeah. 7:56. We're going to take a short break. Then we'll sign off on the TV side, and we have the governor of Guam.